Good. Hello, everybody. I think I saw some of you this morning. Um, yeah, welcome to this session. It'll be very different to the morning session. We've got a lot of contributors beside me. The most important, Joanne, who is here in her convening capacity as part of the HISP Africa Hub. And then we've got some inputs from Lynette from Zimbabwe, Jean-Paul from Rwanda, and Melika from Ethiopia. About what? So I'll give you a little bit of background, and I'm going to call up Joanne to also help with the backgrounds. And then we'll talk about what we've done. With a background to what? Are there any Global Fund people here in the room? Global Fund. You're Global not just Global Fund. Yeah, so the project that we're going to be describing today is a Global Fund funded project, which is about integration and interoperability, focused on four priority countries for Global Fund. I don't know, Joanne, do you want to give a little bit of background to the before I shoot off with my slides?
Yes, good afternoon, everyone. And thank you so much for joining and keeping time. As Bob said, we would really like to focus on the questions that you have and any feedback that you have. But I will just start by giving a background. So my name is Joanne Komgesha. I work with HISP Uganda, but my main role is to coordinate the work that we do in HISP Africa. So I pretty much am the central point for a lot of the cooperation that we do among the HISP groups. And it is really central to how we as the HISP network work. To give a bit of a background on how this happened, the Global Fund, we have an agreement with the Global Fund to do work around interoperability in countries. But from the organization standpoint, from my standpoint as HISP Africa, the priority really is to, number one, make sure that us as HISP groups operating within Africa cooperate and work together to really leverage the skill set that's within our HISP network, and also to apply these same lessons in all of the countries. How is that done? By a lot of meetings, a lot of gatherings. So to give an example, when we started this work, we, Bob and I and the rest of the team in HISP Africa, decided that we would have a workshop that is central, and the priority countries would attend this workshop. And together they worked on some of these tools. They refined the tools, and now we are working with, first of all, the four priority countries, and we hope that with the resources that we'll be able to roll it out to other countries that we are working in. So yeah, I think that's really it. Okay. Yes, thank you very much, everyone.
Thank you, John. So yeah, the substance of what we've been tasked to do, or what HISP Africa Hub have been tasked to do, is in two parts. They're to do this interoperability readiness assessment, if you want to call it that, or exploratory assessment, which is a very small budget project. It's meant to be a fairly light touch thing. And then following that, they have to identify at least four, I think, concrete integration projects in the priority countries, which what the intent is that they should emerge from those assessments. So I want to move fairly quickly through my stuff because I want to give people a chance to talk. I will say that about 2 months ago, this session sounded like a really good idea because we thought we'd be pretty much finished with the assessments, nearly finished coming up to the end of June. In fact, we're not, so we're very much work in progress. And I think part of our value out of the session like this is to just sort of tell you a little bit what we've done, how we've done it, and try to get a bit of feedback on that process. So there are different ways, different kinds of assessments you can do. And that's how we started. So, well, what assessments have other people done? And can we just use that? There are different kinds. There are maturity sort of assessments. Those ones are the ones I call they're judgmental assessments, because they're the ones you emerge with a score and you see how you're ranked against others. You see how you might improve your score over time, etc. It's not one of them. And then you see assessments which are usually the formative process in blueprint developments. They tend to be a little bit more in depth. Again, we're not really in the process of developing blueprints. We did discover, mind you, while doing our assessment, that there are other people working in the same country who are doing very similar things, including developing blueprints. So rather than talk about what we're not doing, what we are doing is what we can call an exploratory light touch assessment rather than in-depth assessment. It has very clear aim, which is essentially to identify opportunities. Identify opportunities for integrations which are validated as being in line what ministry priorities might be, emerging from them rather than imposed. So we're not prescriptive. We're not coming in with what we think you should do. We're trying to find out what we think we should do. And the only, I suppose, little constraint on it is that from our perspective, we want it to be something to do with DHIS2. But it's not limited to DHIS2 in terms of what you need to look at, because part of, a bit like what we were discussing this morning, we need to understand DHIS2 in the context of where it is. It's not something I think that HISP Africa has been involved with before. It's not something little bits. Some of this work is quite new for a lot of the HISP groups. And I think that's been really, really a lot of fun. We've been learning a lot and learning from one another and moving a little bit slower than we hoped. But the assessment itself, yeah, we decided to structure it in 3 parts. First thing is a kind of quick national landscape identification. What are the key structures? What are the regulations? What are the plans? What are the systems? What is there? One of the interesting things that we decided to impose from the start, particularly, we want people to come up at some point with a diagram. What are the key systems in the national picture? We did not want to talk about anything which doesn't exist, which is kind of sounds like a weird constraint. But if you go anywhere and you ask people for where's their national architecture diagram, they'll show you all kinds of pictures with all kinds of boxes. And usually about 25% of them are actually real and the others are aspirational. And it's good to have those aspirational diagrams and pictures and aspirations. But it's not good to try to build concrete integrations on things which are not actually there. So it's quite a difficult task to actually just restrict ourselves to what is there rather than what might be there. Having done this first part of the landscape identification, the next stage, if you like, is to document what we call the interoperability characteristics of the. If we see these are the critical systems, so what are their characteristics which can make them easy, hard, useful, or not to interoperate with. And from that, we emerge then with 1 or 2 of what are validated concrete integrations that could be done within a particular scope. I'll just go through those 3 parts just a little bit quickly. We didn't want to make up our own assessment, so we looked up all kinds of different assessment tools. This one I came across, I quite liked it. So you'll find them everywhere. OpenHIE will do it, WHO will give you, there are many assessment tools out there. We like the one from Measure Evaluation, even though it's actually designed as a maturity type assessment. But what we liked about it is that It made sure that by following something rather than making it up, we're covering all of the base areas that we might not have thought of otherwise. It was not too long. It's only 17 pages, so it's not a major exercise. At least not a major exercise to read it. It has three main sections within it. One is around leadership and governance, the other is around human resources, and then lastly about technology. So that in itself was useful because particularly the geeky part amongst us wants to go straight to the technology, but it's useful to have something to guide us through the sections. We kind of abused it quite a lot. So we ignored everything to do with the scoring, because that was not our intent. We also decided to skip lots of sections because they didn't seem to be relevant. And then we had quite a lot of sections around funding, which at the time, 2 months ago, people just didn't have too much stomach to talk about what the funding was going to be like. It was all too a bit unclear. When we're looking at the individual systems, right, you identify critical systems. Remember, by critical, I say that you can define that in, there are two characteristics at least. First of all, it must exist. It must be running. How we define something as critical? Well, if you think about if it goes down, does the phone start ringing? We find that with a lot of DHIS2 implementations that as soon as they go, unfortunately goes down more often than it should. But then the phone is going off the hook and you know people need to have it back up again. It has to be up and running. There are other systems, including some DHIS2 systems, where they can go down and it might take a week before anybody has noticed. Those ones would probably not be as critical. What's the status of the system? Is it something that's being piloted? Is it something that's on the way? So it's in that aspirational map. Is it something that's been planned for, or is it already established and mature? And I think with integrations, one of the things I've learned, at least over the years, is that you think of integration like building bridges. Right? You build a bridge across the valley, but if the two sides of the valley are not solid, it's very hard to build a bridge, right? So we're looking for solid things. What data does it process? What kind of API does it have? Is it compatible with what standards and that kind of thing? And then for DHIS2 specific systems, and maybe this is not actually specific to DHIS2, potentially we think how we would evaluate a DHIS2 system in terms of its interoperability or integration readiness. You want to do a performance assessment. Is it actually running okay, or is it crashing 3 times a week because it's overloaded? Right. So how is it performing in that sense? We talked a little bit last week amongst the HISPs about doing security assessment. It's quite important. But when you start integrating systems together, one of the things that you do is you open up a whole new world of different security challenges and privacy challenges that are multiplied. So it's important to assess the systems that are involved. Do they comply with a reasonable level of security? And then from DHIS2 perspective, looking at the metadata is absolutely key. If people ask me, can I interoperate with that DHIS2 system? The only way you really know whether it makes sense or not is let me see the metadata. How well organized is the metadata? Is it consistent? Or is it a mess that has grown over 15 years? And those kind of systems are quite difficult to deal with. So this part, I think people are kind of at the moment, busy documenting the systems and just trying to note some of these key characteristics. Then the aspect of identifying key integrations, these ones are quite important because we might actually get some money for doing them. So we've got to pick well. We have to pick ones which meet some kind of valid use case. We don't want to do things just for the sake of doing them. It has to have some use value. Also, a little bit like we were discussing this morning, we want to do things that reinforce the architectural vision. That's why it's important to understand what that vision is. At the very least, we don't want to do something which is contradictory to the architectural vision. Sometimes that happens as well. Scope, obviously, you ask people, what do you want to do for integration? People have many great ideas, but we have limited time, we have limited budget. We need to be careful of picking something which is within the scope of feasibility. Again, kind of related to the security. I think it's quite important. If we were doing this in a GDPR regulated environment, we'd have to do something called a privacy impact assessment. I think a privacy impact assessment is something that we will do once we've identified particular integrations. So, what we learned so far in this rather slow journey is, first of all, I guess the power of collaboration. We talk about collaboration a lot, but I mean, what we immediately found by throwing people together and have them start working through how they're going to do this. We discovered in Zimbabwe, they have quite a good business analyst called Lynette, who started teaching everybody BPMN. And that's now a very practical skill that's been spread across the network. We find it very useful. We discovered when we were looking at, well, how do you assess an integration, that Ministry of Health in Rwanda have a fantastic checklist tool that the others didn't have. And so we've stolen that from them and we will share that across. These are the kind of things that we wouldn't have come out if everyone was just doing it on their own. Zimbabwe did its thing, Rwanda did its thing. By doing stuff together, we're really realizing a little bit of power of getting the skills, the benefit of skills that exist amongst different groups and in different countries. A slightly sobering discovery was a mistake of mine. The measure evaluation might be very short, only 17 pages, but that's how short it is to read. But when you actually do it, it turns out to be maybe slightly longer than we thought it might be. But I think people have found it interesting and useful doing it in country. We also found out a really cool thing about open function. I mean, I know the open function people are not here, are they? No. They have some really, really good documentation on this stuff. I mean, I discovered that they're actually much better at doing it generally than we are. I mean, they should be because it's their specialization. But I mean, if you're looking at documenting the business case for an integration, for example, if you're looking at doing the privacy assessment on an integration, they've got really fantastic documentation. We're gonna definitely steal that, but also probably work together with them as well to make it even better than it is. So that's what I've learned and some of what we've learned. What I want to do is to turn it over to the different groups who've been involved, and I know we're at very different stages, to just very quickly, like me, just reflect a little bit on what you found out so far and what you learned from the process. As I said, the idea of sharing all of this with you, even though it's very far from complete work, is to get a little bit of feedback. Alexa, you just made my point by said nice things about open function. I should say we have Zimbabwe here, we have Jean-Paul from Rwanda, who's going to come in remotely. Unfortunately, he's not here, and Melika from Ethiopia. Thanks, Lynette.
Thank you, Bob. Can you all hear me?
Yeah.
All right. My name is Lynette Msekiwa, and I'm a business analyst with HISP Zimbabwe. So the whole integration needs assessment started off with an integration workshop in Zimbabwe, and we had TA from UIO, thanks to Bob, and the other countries were also in Zimbabwe. It was a great workshop. So yes, I had to go through BPMN with everyone because I was the only one who was familiar with it. So for the assessment in Zimbabwe, we have discovered that there are numerous health information systems in Zimbabwe that are being managed by different departments within the Ministry of Health and Child Care. And the structure is quite clear. There are policies in place that are speaking to HIS integration, including also the recruitment policies, where we have personnel that are being recruited to support integration initiatives. The list of systems that are available is non-exhaustive. We have a lot of them, but this project will focus on the critical systems that are speaking to the day-to-day health data management. And then there also exists infrastructure that supports HIS integration, and there's continued work being done to ensure that the infrastructure is enhanced. So this is the structure in Zimbabwe. The upper part, starting from the Minister of Health to the Chief Director of Policy and Planning, is more of the policies, the approvals, and the decision-making, where the bottom part speaks more of the management and the operationalization of the policies and the decisions that are being made at the top. And then this is the HIS structure, where everything will go through the open HIE, which is the middle part there, the middle layer, and it's making use of FHIR. So we have the Impilo EHR system and all the other smaller systems on this side, and then it goes through the open HIE, and then we have DHIS2 as the reporting tool, and also Power BI. So all that data is being collected from this side, it goes on the other side, and then there's the analytics. So I think Bob talked about there being these architectures that are flowery and not necessarily already in place. So this is that. And then when we come to this one, it's now what's on the ground and what's closer to what we want to achieve. So these are the critical systems. We have the EHR system, which is termed Impilo. Impilo means life in our local language. And then we have the laboratory system, which is a custom system, and the ELMIS, which is also a custom system. So all the integrations are going through the open HIE. There's no point-to-point integration. Currently, there's an instance of the National Health Information System, which is a test, which has been connected to the open HIE, so it is receiving and sending data. The work that really needs to be done now is to also have the ELMIS sending data to the open HIE. In terms of the interoperability characteristics, I think this table shows that pretty much of the checklist is there, and these systems can be integrated. Unfortunately, because the data for ELMIS had not been validated, I could not add it here. So the key integration projects will include, okay, I'll start with the ELMIS, sending data to the DHIS2 in terms of the vaccine stocks, and then also in terms of the cold chain equipment. And then LIMS, that is the laboratory system, sending data to the DHIS2, and then also the EHR, sending data to the DHIS2 system, which is the National Health Information System. So I decided to talk about MOBI EMR last because MOBI EMR is a mobile application which is conformant to DHIS2 and can fit into any use case. So all these other critical systems can actually be making use of MOBI EMR, and then it can then be sending data to DHIS2, and then it goes through the OpenHIE and yes. So this is an example of a use case for integration, which is the ELMIS sending data to DHIS2 for cold chain. So to those who are not familiar with BPMN, that's an example of a workflow that is done in BPMN using Camunda. Then some of the user stories we can look at for this example is, let's say I am a health worker at the HMIS and I need reports on cold chain. I might want to see the distribution of equipment across the provinces. I want to see the service uptimes for each equipment. I want to see the maintenance schedule. I want to generate temperature monitoring charts for each fridge. So those are some of the user stories that we can consider for integration. And in terms of reflections and approach, like I said earlier, we started off with the workshop where we all grouped, we were introduced to the project, to the documentation that we needed to develop. And from there, we went to the ministry. We conducted interviews with key personnel. Some were virtual, some were person to person. And then we also did documentation review. We discovered that there are people who are working on a blueprint in terms of the integration needs assessment in Zimbabwe. So we also did a review of some of that documentation that has already been done. And then in terms of the limitations, like Bob highlighted, we thought by now we would have completed the needs assessment, but sometimes the interviewees were not available, and also access to unpublished documentation. The lessons learned, currently only the EHR and the LIMS systems are integrated, and they are speaking to each other through the OpenHIE. Excuse me. And then the Zimbabwe HIS environment is enabling for integration. We have the policies in place, we have the buy-in from the top, and we have the resources, we have human capital. So I think we are rightly placed to have integration projects running. And then like I indicated earlier on, we are using the OpenHIE and OpenHIM, and there's no point-to-point integration for systems. Then from the suggested integration projects, it's only involving aggregate data, so it will be quite easier to have the integrations done. And like if there had also been tracker programs, but however, we could actually involve other tracker programs as we progress with the work. Then there are ongoing interventions to improve infrastructure and connectivity. For example, right now the Ministry of Health is working on installing Starlink internet kits in all the facilities. So that will enable data collection at all collection points, and it will also assist in having real-time data being integrated across the platform. And then we are utilizing the High Performance Computer Center, which is housed at the University of Zimbabwe, which is the biggest university in our country, and it is being used as a backup data storage and also for data analysis. In terms of the next steps, we are going to be working on finalizing this documentation we are working on in terms of the assessment, and then also do a validation with key personnel within the Ministry of Health, and also do a presentation and sign off of the document, then a submission to Global Fund through UIO. Yeah, thank you. Thank you. Thank you.
Hi, John Paul, can you hear us?
Hello, Jean-Paul.
Hello.
We hear you. All right, Jean-Paul.
Yeah.
So you're going to share your screen from where you are.
Yes, I can.
We're running a little bit tight, so about 10 minutes, and then we'll
Okay.
let Melika go from Ethiopia.
Okay.
Should I share it from here?
He hasn't shared.
He hasn't shared. All right, we can see your screen now. There we go. I see your slides.
Miss it?
Yep, we can see you're at the start.
Okay. Okay. Thank you, everyone. My name is Jean-Paul Mutari. I'm from East Rwanda. I'm going to take you through assessment that we are currently doing with the Ministry of Health and other partners. We thanks to Global Fund for funding this activity and University of Oslo for participating work. So in Rwanda health system, currently there are more than 30 systems deployed from national level up to the lowest level country to the village. But more than 55% of those systems are DHIS2 based. So there are many DHIS2 instances deployed depending on the use case. There are also active integration between systems, whether DHIS2 to DHIS2, DHIS2 to other systems, or even other external systems which are integrated between themselves. So the digital health ecosystem in Rwanda mainly has some core systems which are used by the clinical or community health workers, which comprises of mainly DHIS2 and EMRs with different flavors. There's Open Clinic, Open MRS, ERP, and so other varieties. And we have also other key platforms which are like the civil registration, national identity, which are used by the local governance, but also the health facilities. And have some middleware where we have, to some extent, we have event-based data which are used using Kafka or other streaming services. We have also some custom API which are being built to have data shared among systems. We have registries. In the concept is to have only 3 registers: client registry, facility registry, but I will come later on this. And then we have parallel program system with like TB, HIV, immunization, and we have then disease surveillance system, lab system, logistics, and the imaging tools which uses AI, especially for prediction. Currently, we are using CHAP, which is DHIS2 based to predict malaria cases in combination with primate data. And then there are some chatbots for administrative or for any information. So all these systems serve the Rwandans and the residents as well. So the base or the end of these results normally is DHIS2, which is taken as a national data warehouse. Also, all these systems are supposed to feed the DHIS2, which is the national data warehouse. And the standard so far, some are using Fire. Most of them have JSON or the XML. For security, as Bob mentioned, for some individual data, there is encryption and control access. And most of these systems are housed at the National Data Center, which is mandatory by the Cybersecurity Office to have all the, especially individual data hosted in the country. And for monitoring, there are some tools which helps to monitor real-time errors of this system and also the synchronization part. So on the integration assessment part, we found that most of these systems are using API-based integration, like for DHIS2 case, but there are also emerging mediator like OpenHIM, which is now being used to integrate some EMR and registers which are being built, which are not yet deployed at the national scale, but which will be part of the final ideal architect of the country. We have, as I said, some based integration, which are using Apache ActiveMQ, which is product from DHIS2. We are using this for follow-up of NC visits with nutrition incentive by the national local government database, which they get the information from DHIS2, then they give incentive for all the mothers who came for the NC visit to support the growth, the growth of the newborn and also the mother. We have Kafka, which is being used for CRVS and immunization track in DHIS2. So these are some of the active integration projects which are currently running using all these variety of integration. So I think the most common used one is touching the majority of every new chart, which is the CRVs and immunization registry. The immunization registry here, DHIS2 tracker. CRVS is a custom application. We'll be taking all the birth register, whether at the health facility or administrative unit, the audience information goes to DHIS2 tracker, and then the vaccination information is done. We have some DHIS2 integration where we have tracker information aggregated monthly to HMIS the automatic reporting without manual entry of the aggregated. We have stock management system which is linked to immunization registry as well. So this logistics system manages the procurement, distribution of vaccine, and then it aggregates this to the immunization registry, and then you can have the dose given and the individual person together. We have a certificate portal which which was used even during COVID for COVID vaccination, for COVID testing, and now used for routine immunization for children. This portal is used by the public, where they get a short message on their phone, and then the credential from there, they can access this. We have a cancer registry, which is DHIS2 again, but for further analysis, which connects to this standalone application. It's called Canada. We have also Tanzania to have the TB, DHIS2 TB integrated with the smart pay box, where this limits the travel of a patient who was supposed to come every day to then the box and taken captured automatically. For the AI, as I said, we have some. Yes.
No, I was just warning you that time is ticking. I know you've been very comprehensive.
Okay. So we have some AI tools which are now coming. We have few now with climate health, and some for prediction and smart assistance. And then for ease integration to be feasible, the enabling factors are first the political will to have this integration done, and also the technical skills, but also the base foundation, like these national identity CRVs, their foundation to have the integration, because we have a personal identifier. And then there is funding for the government and the partners to have this integration done. The key challenge for now, which we found during this assessment, is that the documentation of metadata for this system, and also the standards between this system. The old system, they are not more compliant with FHIR, which is being pushed to be the gold standard, and the system which are not yet managed ministry, which rely on this one for to give access or have the API. It sometimes takes time because it's not maybe in the contract or was not part of the initial design. And also there are some systems which are still under development. I come back to the registers. The registers, for now, they are scattered in different systems. There is no like one register which is being used by all the systems. In the infrastructure as well, so it's not performing compared to what the integration or even at the system being deployed. And also that goes together with when you have one testing environment, it's not a challenge. As a conclusion for this, we found the pressing priority for the ministry for now is to have the EMRs which are being implemented in synchronize or send data to the DHIS2 instances, whether for aggregated reporting or for vertical program to have the data separated or to keep even the privacy of patients. For example, if the TB program want to have only TB patient, they may pull this information from different EMRs, but select only the TB patient, the DHIS2 tracker, and then do any analysis or even do clinical trials or research on those data without having access to the whole data set of the EMRs, which are now being rolled out. So I thank you for attention, for feedback. We can this. Thank you.
Thanks, Jean-Paul. Well, I think we've got time just for Malika to say a few words, and then we'll go get into some questions.
Hello, can you hear me? Yeah. Because we don't have time, I will not get deep into it. I just want to say that we are in the process of initializing it. Yeah, we're in the process of starting the process. So basically, we have different rounds of HIS reviews in the country, and for the purpose of this initiative, as Bob mentioned, like this is the dream that we want to achieve. But the good thing is, the ministry already has identified which are working, which are not working, which are in pilot phases. So most of the green ones that you see are there. They are in production phase. Of course, the intensity and the level of impact may change, but most of it is there. So there is the HMIS, which is the DHIS2. There is an interoperability layer, which we're trying to use OpenHIM to act as a middle layer between different systems. And there is the shared services. These services are like core components for all the other digital health initiatives. And there are also, of course, point of system services that we want to do. So the challenge we have is that, I mean, it's not really a challenge, but there are a lot of, as John Paul Mutali has mentioned, is that within the system, within the ministry, there are more than 60 digital systems officially registered. And it's even expected that within the country, it's going to be even more. So choosing the right one that has the most impact And that is the critical one, is a bit of a challenge. And we're still discussing with the ministry on which ones we should prioritize. And there are also ongoing integration projects that are being funded through different partners. So coming up in that landscape where we can just fit in to the existing architecture so that we do not break it, and as well as coming up with a really impactful integration project is what we're trying to do during the assessment phase. So this is it. So we have potential candidates that we are planning to come up with. It's EMR with DHIS2. There is already a MFR Master Facility Registry with DHIS2, which was presented 2 days ago. So that can be improved. There's also other options that we're looking into. And I think once the assessment is done, then we will meet next year to show you our results. Thank you.
Cool. Thanks, Malika. And thanks, everybody. Thanks, Lynette. Thanks, Joanne and Jean-Paul in the internet. I think what you saw, it's quite a rich picture is emerging in different places, and some of it is all very predictable, and other bits are very surprising. But that's where we're at the moment, and we hopefully these assessments will be through in the next month or so, and we'll start moving on to concrete work. But any reactions or thoughts or questions or clarifications anyone might be looking for? Do we have a more?
Okay, thank you so much. My name is Habib Bushra. I am from Ethiopia, Minister of Health, as well as JSI. I want to just add some more on the Malaka's presentation, especially on the MFR DHIS interoperability, that the ministry was led and that we get a huge support from HISP Ethiopia. It was the first of its kind for us as a country to realize the health architecture that he showed before. And it was a great achievement that we learned a lot. One of the big challenge that we faced was we were in the era of like thinking interoperability is not possible in the Ethiopian context because of the number of tries we made and the number of tries we failed to realize MFR DHIS interoperability, but with a good understanding and a good development, as well as also a support from HISP, we managed to make it interoperable. I think you can find a session for the lightning talk that we present yesterday. But just some of the questions that I had is maybe for all, maybe someone can answer. So whenever you interoperate two legacy systems, especially the AMR as with DHIS2, you have to make data element mapping. So how do you handle such kinds of mapping? Because the number of elements are huge, and that's making it much more difficult to make it interoperable in most systems. Thank you.
Well, first of all, yeah, thanks for the comments on the MFL. I think completely foundational in Ethiopia to have that MFL working. It opens up lots of possibilities. Before we were wondering how on earth are you going to do the facility mapping?
Yeah.
Now we have that problem behind us. You point to the next problem. Mapping. Alexa, how do you deal with mapping when you have thousands of data elements? Yeah, I'm cheating. I'm bouncing the questions.
Mapping. So Alexa from OpenFN, we do a lot of data integration and interoperability work as a digital public good, and work with partners around the world that deal with this problem of mapping. And it usually starts with programs and people deciding how do we exchange meaning between different programs and people. And we've seen a number of different approaches from good old spreadsheets, honestly, is the most easiest way, like a Google Sheet, to being able to collaborate and just define these data dictionaries for how, for example, I define diagnoses, how you define diagnoses, how to translate them between the two. I've seen some organizations use Open Concept Lab, another digital public good that's like a terminology service that you can kind of capture these data dictionaries, but also mapping. And they also have an API, so you can kind of pool that mapping dynamically. Even with spreadsheets, we've got a couple of integrations that like dynamically will pull that kind of logic from the spreadsheets, which is quite interesting. And there's been a lot of development lately around mapping tools if you're using standardized terminology like low ink codes and fire context, things like that. I know our team as well as Open Concept Lab have been working on some initiatives to use AI to at least suggest mappings, by no means decide the mappings, but maybe accelerate that process. And then that way, someone who has kind of more clinical experience can come in and review and kind of approve those different mappings. But it's a really tricky process. So I'd be really interested to hear kind of what other folks have done. But Lynette, it was really nice to see those BPMN diagrams up there. We use that a lot in our documentation as well for process mapping. And like I think BPMN is a really nice standard that is universal. And it's good for both human business process documentation as well as it translates pretty cleanly to software process documentation. So for us, kind of adopting a global standard like that has been really helpful for, you know, even if someone else takes over the project, they can really see that documentation and learn from the next person. And even though I don't know anything about what's going on in Zimbabwe right now, I could understand the diagram up there. So that was cool to see. But yeah, curious if anyone else has strategies around this.
Yeah, I +1 to the spreadsheets. But one thing I think is it can seem overwhelming, right? Particularly if you're looking at your national HMIS, you've got thousands of data elements, but you don't always have to map all of them, at least not all at once. So, you know, typically maybe you have to receive an aggregate data set from the HR system, for example, the number of doctors. So then you have a subset. So you have a smaller, you need to map the ones that you need to use first, and then standardize them. Whether you're going to publish them. Whether you're going to publish them using FHIR is a good way of publishing metadata. Because once you've got something and you've put work into mapping, once you've published it, then also it gains a bit of stability and also some visibility. So it'll make it easier for others to use. Any other thoughts, questions? I think we have time for one or two if it's short. Let's give somebody else a go. I've got one here and I got one there, and others I'll come back.
Okay, thank you. Just my question is just a general conceptual question for the presenters. Just both they presented the integration related initiatives, what they have planned in their country context. But there is some concept like integration and interoperability. So, for example, for Rwanda presentation, may we think that they have more than 55% of their systems DHIS2 based. So are they planning to have a kind of unified, integrated DHIS2 platform to the country level, or to have multiple systems that can exchange the data using the HI platform? So there is a integration and interoperability concept related.
Paul is there, can answer that. But what I think the answer is that over the last 10 years, you've seen an explosion of DHIS2 systems in Rwanda. Now they're trying to pull them back together again because it turns out to be quite hard to manage so many. But John Paul, are you there? I don't know why I'm looking around.
Yes, I'm there, but my internet was cut. I didn't hear what was the question.
You didn't hear the question?
No.
If I got it right, the gentleman in the audience from Ethiopia was pointing out that you talked about having 55 plus DHIS2 systems in Rwanda. Is your plan to integrate between all of those, or to contract them, or how are you planning to deal with it?
Yeah, thank you. Well,
If we look next year, Jean-Paul.
Not 55, but but it's I said 55% the system are DHIS2 based, not 55 instances. But yeah, we have tried to compress the number of instances based on the use on the organization unit where they serve. So where it's possible, we are trying to do it, but the one instance or two are not enough for the whole programs or the use case. That's why we have so many increased key information like the organization unit, the codes for the organization unit, and the other thing we are exploring is if there is a STEM user, we have the single sign-in so that the user will not be frustrated to have a username and password in different systems.
Oh, okay. Good answer, Jean-Paul. So I think if you count that, first of all, you need to understand how you count. Say 55 systems could, in certain ways, it could be 55 programs, or it could be 55 DHIS2 instances. But I think one of the problems that they're trying to solve in Rwanda at the moment, and making a lot of progress, is there's an old single sign-on thing. So it becomes transparent that you have many systems. At the moment, it's quite complicated because you've got to manage users and all of these. I think we have gone over time. We have one. Do you want to have the last word, Jose? No? All right, but thanks. I think let's thank all the presenters. There's a lot of hard work has gone into that.